All right, very fiery discussion that we're having over there. And of course, you just said Dr. Akhwale in Studio V, right? And I do not want to lose Dr. Akhwale. So can you just briefly respond to all these concerns? And also, given the feedback that we read earlier on, where everybody's like, absolutely not, no, thank you very much. And Marceline is, again, raising very valid points. And also, someone is actually asking me, so will the government arrest everyone who's not vaccinated?
Does the government? No. Okay. Now, thank you very much for that. And let me mention first two things. Starting with the booster shots, you've seen the numbers and you see that the counties, urban counties are doing very well, and the arid and semi-arid counties are not doing very well. And let me remind Kenyans, when we began our vaccination program last year, we began by prioritizing frontline health workers, majority of whom were healthcare workers, security forces, and teachers. And what you are now seeing, the booster shots, are the people who were fully vaccinated by 30th June, because you have to finish 6 months. So what you are seeing there is not necessarily population. It is based on the number of healthcare workers who are the main drivers of vaccines at that time. It is at the end of March that His Excellency took his vaccination, and then we opened to the general population. Now, next month you may see now the 58-year-old taking up more of the booster shots. So what you have seen is actually a reflection of how many healthcare workers. And during that time, we observed a county like Kajiado. Immediately we opened the 58, it became very high numbers because a lot of people have settled in Kajiado, but they don't have as many big facilities as Nairobi, Nakuru, or Kisumu. Okay, having said that, now the second thing, and this comes to the issue of expiries. As we speak now, there have been no on-shelf expiries of vaccines in Kenya. And when they will occur, if, then that will be known, because we have to account to the people donating to us. We'll tell them the vaccines expired. We'll not have to show them. We have to show them where they reached. And you must then realize the reason, two things have worked in our favor. Strategically, we adopted Johnson & Johnson, which we send to most of the hard-to-reach areas where the uptake is slow. The shelf life of Johnson & Johnson, when stored under refrigeration, is 2 years. And if you look at how many stocks of Johnson's we have, you will find they are the majority of vaccines that we do have. Now, I know the issue of AstraZeneca. That is the one that keeps us working very hard to ensure that any doses that are near expiries are used where the demand is there. We go beyond our call and even fly vaccines across counties to ensure that there are no vaccination. But there's something known as wastages. And for example, when you open AstraZeneca, after 7 hours, you have to discard it. You can't use it. Wastages do occur. But at the same time, within a vial, you could get 1 or 2 extra doses and you vaccinate more people. And every month we look at the wastages against the gains. And the last that I looked at last December, we had 3% efficiency, meaning that out of 100 doses we administer, we actually vaccinate 3 more people. Now, coming to the question, do we know who is not vaccinated? The only way we want to know that is by giving you a certificate. That's why we developed the Chanjo system, so you can be asked if show proof of vaccination. It is basically through that vaccination. Otherwise, in terms of data protection, we are not going to go and say you by name, you are not vaccinated.
But Dr. Akhwale, why are we talking about booster shots, and yet from the statistics that we received, only 5 million people in the country are fully vaccinated? Like, why are we talking about boosters to these people who are fully vaccinated, and yet there are some counties where there are some people who have not received even the first dose, of a vaccine?
Okay. Now, let me, in terms of doses, from where we sit, you saw 1 million. In fact, let me assure Kenyans that in terms of the number of doses that we need to both have booster doses, remember booster doses are very important to protect the people who are affected and likely to die from the disease. The frontline health workers, if there's going to be a pandemic, we could lose, and then the healthcare system is overrun. We have enough doses for both full vaccination, and Eunice asked me offline here, are we going to achieve the 19 million? If you look at our statistics, see that 6 million people are partially vaccinated. Immediately they take their second dose, they'll be fully vaccinated to add to the 5, and that will be 11 million. Then the other thing you need to know, Johnson & Johnson, one shot is full vaccination.
But I think we still have a problem. We still have an issue of people who have not gone for their second dose. I remember last time you were hunting for people who have absconded the second dose. Do you think
about 100,000 of them?
Yes, 100,000 people who had absconded.
Yes.
So do you think you're going to make to 19 million in June to ensure that these people who got their first dose get their second dose?
Without coercion.
Yeah, without coercion.
By the way, that situation changed, and I'll explain. And I wish I came with a graph to show you.
Okay.
That situation occurred in especially August and early September. And the reason was that's the time we were getting our first Johnson & Johnson, Moderna, Pfizer was coming. So people who were taken, the others were now waiting and saying, I want to change the vaccine. Currently, the uptake of the second dose is actually not a worry. People are coming for second doses because now people have settled on the vaccines. In fact, it's very interesting that demand for AstraZeneca is actually high. There are now those who have said, I'm AstraZeneca. There are those who have said this. So that was a temporary, and I have a graph that can actually show the uptake. That's not a very big issue for us now.
I'd like to know people who are interested in Sinopharm vaccine.
Okay. All right, let's come back to this. And you know, we're talking about booster here, booster there, booster shots, booster here. And earlier on, I asked Professor Julius Oyugi, will it ever get to a point where we'll need a booster on top of a booster, right, to get vaccinated? Because like I said, there's that meme of someone who's like, by the time it's like 2030, hiya, my forehead, everywhere else, you know, all full of needles because of the vaccination. So just talking about booster shots, why it's important, and will it get to that point of a booster on top of a booster shot?
Yeah, thank you very much. So I want to say two things about booster vaccination. Number one, the current vaccines that we are using, when they were developed, you remember earlier on we said they were developed within a short time. So we didn't gather enough data to know how long the protection will last. So that was one thing. So that data is being gathered as we move on. So what is coming out is that there's a possibility that the protection that this vaccine offer, they wane with the time, they go down with time. And for you to be fully protected against the circulating, COVID-19 virus, whether it is a new variant or the one that is already existing, you need to have your immunity at a certain level. And that is the reason why booster vaccination has been implemented. Most people say that booster is because of the Omicron. Omicron is just coming because most people have now gone past 6 months. Most of the vaccines were estimated that the immunity will last, will start going down after 6 months. So that is the reason why we are giving people boosters. That's number one. Number two, we have had a few variants of COVID now circulating in the population. And the viewer was asking, by 2030, will he have, 30 or 100 boosters?
Boosters, yes.
Yeah. So what we know for sure for now is that even the emerging variants of COVID-19, the vaccines that we have now are fairly good in protecting people from getting serious disease. So we have not seen a situation where a variant has emerged and our vaccines are completely useless in protecting people. So the protection that they provide is very broad. It's unlike other vaccines which only target one aspect of the virus for protection only. So it is important that viewers understand that the boosters, so if we talk about the immunity lasting for 6 months with the previous vaccines, we are also going to gather data. If you get a booster, how long will you stay protected, right? Is it going to be 6 months, 1 year, 2 years, right? So depending on how long you will maintain immunity with the booster, that is what will determine how many boosters you are likely to get. But finally, I just want to remind the viewers that there's a virus, influenza, which I think most viewers may probably know, that every single year we make new vaccine because of the emergence of a new variant every year. Yeah. And people who are at risk of getting severe disease due to influenza are given vaccine, which is made on annual basis. Only people who are at risk, right?